Late. Okay, so talking about our topic, tech snack, a global epidemic. Epidemic is those conditions or those diseases that occur in a particular time in a particular community. And with regard, if we talk about the tech snack, so tech snack is actually pain in the neck and its surrounding structures. Its surrounding structures mean that it's not related only to neck. It will have symptoms around the shoulders, around your upper back, and your hands too. And it is related to texting. As the name shows, it is related to texting. So when you use your smartphones for a prolonged period of time while your head is forward bent over your phone, so that causes the neck pain, and that is the main effect, that has a main side effect on your neck. For those who are joining, who joined in a while, I would like to start with the introduction again, because there are many people who are joining in between. So my name is Hoor Ali Kakar. I'm a lecturer at NCS University System, and I'm graduate of Khyber Medical University, Peshawar, Pakistan in 2019. Currently, I'm doing Master in Musculoskeletal Physical Therapy, and this topic, neck syndrome, was twice my research topic. That's why it's really a point of interest for me, and this topic needs really awareness. So the main point why I select this topic, I will tell you later. The contents of our presentation or session is, first we will talk about what actually is neck syndrome, why it is this much necessary that we are calling it an epidemic, what is the prevalence rate of this condition, what is smartphone addiction, its causes, what are its clinical features, how will you examine your patient with TNS, what is the differential diagnosis, how will you investigate prevention and management. So there is a famous saying that don't be a sufferer of tech snack in the era of high tech. As you all know that I know this right at the right moment, many of you are using your laptops, but a major amount of participants here will be using their smartphones. They will be attending this session by using their smartphones. So smartphones are very integral part of our life these days. We are using smartphone for almost everything, and it is based as such, like it for all the apps, it is based for everything we use our smartphones. If we talk about the quarantine phase, or everything gets online, or classes are online, or lectures are online, if we are attending the workshop online, quizzes online, exams are online, so everything is connected with these electronic devices. With the advancement of technology, we are more concerned with it and we are more connected with them. So these things, if you do not use it in a proper way, you will destroy your body, and you will have that side effects on your body. So this is what all TechSnack is about. So coming towards the introduction, the word TechSnack was first introduced by Dr. Dean L. Fishman. He is a US chiropractor, and he has done a lot of work in this particular topic. Like he invented this in his clinic. He was doing his routine work in his clinic. One of his female patients visited him from quite a lot of time. She was visiting, and her symptoms were not relieving with the treatment. So what he saw, that she was waiting outside and she was doing texting with her head all bent over her phone. So that time his mind clicks there that this forward bent head or forward head posture can be the cause of this neck pain and neck stiffness, which is not relieving. So he thought from that point, then he researched about it, and then he come to the point that concluded it that Text neck syndrome is actually related to the overuse of smartphones. When you are using your smartphone for a prolonged period of time with your head forward bent or hunched down over it, so this can cause neck pain, neck stiffness, and all the symptoms that are disturbing your spine and have deleterious effects on your body, your posture. This posture and your these smartphones, they are interconnected. If you are using it with a proper way, you can have you will have no symptoms, but if you are not using it in a proper way, it will have some side effects on your body. So I will straight away tell you or instruct you how to use your phone or devices which are using right now, which we will later talk about the prevention of text neck syndrome. But I want to instruct you right away about this thing, about your posture, because it is important as you are using it right now. As you can see that I'm using my laptop, and my laptop is just at the level of my eyes. My screen is just at the level of my eyes. I'm not poking my chin out, or I'm not over forward head. I'm not doing forward flexion over my spine. So I just want you all, if you are using your smartphones, bring it on to your eye level. It should be at same, the screen should be same to your eye level. If you are using your laptop screen, so made it at your thorax, or the screen should be at your eye level. Make your body posture normal, okay? Normal and relaxed posture. So as you all know, mobile technology has become very widespread around the world, and people are more using their quite a lot of time on their smartphones for different things. They are even reading, they can be doing video games, they can be doing some quality work, but if they are not using a proper posture, then it is not going to work. They will have the side effects, they will have faced this situation. So the main point here is your body posture. You should align your spine in a normal position. Text neck syndrome can be the leading cause of various musculoskeletal disorder. And if we talk about the neck pain, so neck pain is the most common second disability which the patients come to our clinics. In musculoskeletal problems, neck pain is the second most disability, and it can have the cause can be different. It can be due to any cause. But if a young patient came to you, a young patient, that can be male, that can be female, young patient of age 18 to 24 or in his early 30s, he came to you with neck pain or stiffness. So you should think about his posture. His posture, you should evaluate his posture correctly. You should examine his posture. If there is any forward head posture, so his cervical spine will have its effect, and his surrounding structures will have the side effects of it. With advancement of technology, everyone is dependent on their smartphones right now, and it is with its benefits. I'm not saying that smartphones are bad. Smartphones are very good. These technology are helping us a lot, but we have to use it in a proper way. If you are not using in a proper way, then it will have the side effects on your body, and it will the side effects can be too serious that it can lead sometimes to surgery. So if we talk about the smartphone addiction, which is also an important thing, if we talk about the text neck syndrome, smartphone addiction is also related quite a lot to it. And every second person these days is addicted to your smartphone. According to WHO defines addiction as if something goes missing, if something is if you are used to something and if goes from your eyes, you just start craving for it. You just want to see it again. You just want to use it again. That is called addiction, when you crave for something when it is absent. So if I take away your phone for some few hours only, so you will have that inside feeling that I want my phone back, and that inside craving the craving will start. And that happens with every second person these days, and even kids have smartphones these days. So its addiction is getting higher and higher. On the other hand, its awareness and its proper use is getting lower and lower. People are not aware of the text neck syndrome. People are not aware how to use the phones, how to use their electronic devices. That's why it is affecting their body health, and people are not even aware. Why they are just saying, I have headache, I have neck pain, I have stiffness, I have numbness. But why? It's just because of your bad posture. Just keep your posture straight. Just know how to use things properly. You will have nothing. You will be living a healthy life. So the young generation, with its addictive nature of to smartphones, had deformed their postures a lot. And if you see, even I conducted a study on DPT students of Peshawar, and I found that even in the DPT students, text neck is related to physical therapy. Even the DPT students did not know about the text neck syndrome. Some of them know about it, but they have heard this word, but they do not know what it's actually about. So this thing, its awareness is very important in the community, and this is the reason behind why I selected this topic. It was quite twice my research topic, and from that I found that it need awareness. This thing need awareness, and this is a serious thing for our young generation and the coming generations too. We talk about the smartphone addiction and internet addiction. So internet addiction is left behind from smartphone addiction now. Internet addiction is 8.4%, and smartphone addiction is 8.4%, and internet addiction has become 7.7%. So this is why smartphones have very serious effects on our life. Talking about the prevalence, so everyone have these days using smartphones, and people prefer texting more than any other form of communication. People prefer texting instead of calls, instead of any other source. And with texting, they are doing hours of texting from day to night, and doing in lying position, in sitting position, while walking, while standing. They are doing it in every position. So it is affecting their posture in many ways, and it is affecting their cervical spine, their overall upper extremity in the many ways. So people should know how to use it, when to use it. You should take breaks in between so that you can avoid this thing. According to a systematic review, the prevalence of musculoskeletal problems with the mobile phone usage was 17.3% to 67.8% neck complaints. So neck complaints with the phone usage, it is quite common. If you ask, if a patient came to you with the neck pain and stiffness, and if you ask about his phone usage time, like in a 24-hour day, how much time you use your phone, so he will say like, what kind of question is this? I almost use it in every situation. I just do not use it when I'm sleeping. Without that time, I am using my phone all the time, and I have it in my hands all the day. So this is why it is having very serious effects on our bodies. And according to another study, 79% of population of age group 18 to 24, that is a young age group, young to middle age group, they carry their smartphones nearly all the time, spending only 2 hours outdoor without their smartphones. And I guess that is their sleeping time uh, uh, when they are not using it. So if you talk about the effects, the side effects of this phone usage on your body, so it will affect your cervical spine, that is your neck. It will have symptoms in it will have symptoms over your ligaments, the cervical ligaments, cervical spine muscles, cervical spine tendons, muscles, ligaments, tissues, all the soft tissues will be involved. Coming down to the upper back, that will be involved. Laterally, the shoulders will be involved, and forearm, elbows, wrist, and even your fingers. You will have symptoms till your fingers. Okay? So this thing can affect your whole or upper extremity with your cervical spine. So the risk factors, if we talk about the risk factors, so it is the forward head posture, the most common forward head posture while texting. If you look over this picture, so the more you bend your head, the more pressure on your spine is coming. The more your angle is going down, the more pressure on your spine is coming, and it is compressing your vertebrae, compressing your disc, and that's why you are having those symptoms like numbness, stiffness over time, muscle spasm, trigger points. So these are all related to this forward head posture while using your phone. If text neck syndrome is left untreated, so it will cause permanent damage, and it can lead even to surgeries. Permanent damage, if we talk about the permanent damage, so it can lead to flattening of spine, the cervical lordosis that will become flat. And if the cervical lordosis become flat, it will leads to early osteoarthritis of the spine. Why osteoarthritis? Because early degeneration will happen, wear and tear of the cervical vertebrae, surrounding bony segments, its tissues will start degenerating, and with that degeneration, early osteoarthritis, inflammation all the time, this will happen. So it is actually an overuse syndrome. When there is an overuse syndrome or overuse injury, so these things happen. Secondly, on the disc, if we talk about the disc, so undue pressure on the disc is coming for quite a lot of time. Disc is working overwork. For example, disc, vertebrae, all the tissues are doing overwork. From if they were doing if they were bearing 10 lb weight, firstly, with the forward head posture, they are bearing 20 lb weights. So the pressure is increased, the undue amount of pressure is increased, and that will cause discompression, and later on it can leads to disc herniation, and disc herniation needs surgery then, in severe cases. If there is any spinal malalignment will also lead to degeneration of the spine. If there is any muscular damage, so muscle damage will lead to nerve damage too. In later ages, that's why the patient will have numbness and tingling sensation down to their upper extremities, down to their thumbs. And also patient may lose the lung capacity. Loss of lung capacity. Lung capacity is actually the amount of air your lungs can hold. So if there is loss of lung capacity, that can cause gastrointestinal problems. And because if your lungs are not expanding properly, your breathing pattern is not normal, so it will have effects on your other organs too. If we talk about the chief complaints, what the patient will present with, so neck pain and stiffness is on the top, then range of motion of cervical spine will be limited. If we talk about the shoulder range of motion, so that will be normal, there will be no pain in the shoulder, there will be ranges will be normal of the shoulder. So we will exclude shoulder here, and we can say that text neck syndrome will only have neck pain and stiffness with limited neck range of motion. If we talk about the range of motion, so cervical spine flexion, cervical spine extension, side flexion, rotation, all four will be limited with pain, and there will be a possible sign of pain. If we talk about similar in the shoulder range of motion, so there will be no pain during the range of motion of the shoulder. Headaches are common. Headaches common due to the muscle spasms. Second is the trigger points. So, and the facet joint syndrome can happen also with it, secondary to it. So that's why headaches are common, and the cervicogenic headaches are more common over here. Patient will have heaviness in eyes due to the close contact with the screen and all the time spending more hours on the phone. So heaviness in eyes is common. Vertigo is common because it is not that common, but in severe cases, patient can experience vertigo too. If the patient is using his phone while lying position, and due to abnormal head position, the vertigo symptoms can happen. Tingling and numbness are common because of the nerve damage. Muscle spasms will happen due to overstress of the musculature, and the forward head posture is the most common thing over here. Forward head posture is the main culprit of the text neck syndrome. So what will you examine? How will you examine? You will have in examination the demographics. You will ask the patient name, gender. If you talk about the gender contribution, so female are more prone to text neck syndrome than male. Why female are more prone? According to researchers, female have more sedentary lifestyle than male. They have protracted shoulders. They have more forward head posture than the male. So that's why gender association here is female are more prone to text neck syndrome than male. Second point is female use the social media apps greater than male, like Pinterest, Instagram. They're all the time scrolling over that, and when you are free, you just do that. So that's why, that's the second reason why female are more prone to it. Age is 18 to 44 year age. That is the middle life age. Occupation related, it is if a patient came to you and that he is a computer user, so occupation is related with it too. It's not only related to the smartphones, it's related to your laptop computer users too. So if you are using your computer and the computer, your desk is down and laptop is lying here and your chair is also not adjusted with it, so that thing can also lead to the forward head posture, the poking chin out. If you are poking your chin out, it will stressing your soft tissues over the spine, so that can affect your posture, and that negative effect will be on your overall body. Neck pain and stiffness with and without radiation is common. Later stages will have the radiation, but in early signs, there will be no radiation or numbness. In the history, the patient will have neck pain issues quite from a lot of time, will have 6 months, 3 months. They will say that I'm facing neck pain from quite a lot of time. Like there will be a chronic history of neck pain with the upper back pain, shoulder pain, headache, heaviness in eyes. So these are all interlinked with each other. History of trauma is not necessary. Past medical history, familial history is not necessary with it. It is not an autoimmune disease. It is not a genetic disease. Personal smoking and alcohol. So this thing can have effect on your spine. How smoking can affect your spine. I was reading an article there. They mentioned that smoking affects your spine a lot, your cervical spine vertebra, but it is a controversial term. Some researchers say that it has no effect, or smoking has nothing to do with the spine, and some researchers say that yes, it has an effect toward the spine. So what happens during smoking, that irritants are released in your body, and that irritants helps in degeneration. Early degeneration of the cervical spine vertebra is common with smoking. So if a patient is doing smoking is a chronic smoker and doing smoking from quite a lot of time with high doses, so they will have this thing, early degeneration of the spine is common in them. History, the patient will say that the onset of the pain was gradual. Onset of the pain is gradual. Location of the pain is in the neck, starting from the neck, radiating to the shoulders, upper back, and then it can be coming to the front. That is the headache. Type of the pain is diffuse. Nature of the pain is intermittent, on and off pain. When the patient is doing activity, he will experience pain. When that activity is off, when he is doing rest, the pain will set off. So it is an intermittent kind of pain. Radiation is to the upper arm, throughout the shoulders, into the hands, and aggravating factors is activity. Whenever the patient is bending down over the phone, it is also called turtleneck posture. So whenever the patient is forward flexing or doing forward head, prolonged forward head posture for a long time, so they will have experienced this neck pain, this numbness will start. When they relieve their posture, when they are coming back to the neutral spine position, the symptoms will resolve. So here, if we look at this picture, this is the normal spine alignment, and this is the forward head position while using this phone. So during the normal spine alignment, there is only 10 pounds weight coming on your vertebrae, on your soft tissues. If you are doing the forward head, so with the forward head, the pressure on the spine increases. There comes, the weight is increased 6 times, from 10 to 60. So 60 pounds weight will increase, and it will have, you just think of it, like if 6 times a weight is increased on just these delicate structures, what will they experience? They must have the neck pain, and they will have this tension and numbness things in that. Objective examination, we will look for the forward head posture. In observation, we'll look for the protracted shoulders and the scapular position. Scapular winging is quite common because of the weak serratus anterior, weak scapular stabilizers with the forward head posture. So if we look to the spine, cervical spine will loss is lordosis, and the spine will become flat. Thoracic spine will be hyperkyphotic due to compensation of the cervical spine. Effects will come on thoracic spine too. So upper thoracic will be hyperkyphotic. If we talk about the gait, so arm swinging of the arm during the gait will be decreased, and we will look for inspection. We will do palpation of the soft tissues of the muscle, looking for the trigger points, looking for the tenderness over the spine. There will be muscular imbalance is quite common with it. Muscle imbalance will have hypoactive and hyperactive muscles. So the hypoactive muscles are the scapular stabilizers. Why they are getting hypoactive? Because they are just losing their strength and they will become hypoactive. They include serratus anterior. These are your scapular stabilizers, anterior middle traps, anterior, lower and middle traps, and the levator scapulae. So they will become hypoactive, they will lose their strength. Rhomboids, shoulder external rotators, they are also common with it. Hyperactive muscles that are prone to become tight are upper trapezius, pectus majors, sternocleidomastoid, tight trapezius plani, and levator scapulae. So these are the muscles that are more connected with your spine. So cervical spine, they will become hyperactive by doing because of the overuse pressure or overuse forces that are coming over it. If we check the patient movements, so active and passive range of motion of cervical spine will be restricted and painful. All the four movements, side bending, rotation, flexion, and extension, will be limited and there will be pain while doing the movement. Shoulder, if you talk about the shoulder range of motion, so that will be pain free and there will be no restriction. Ranges will be normal. Neural claudication, that is paresthesia or numbness tingling, is common. We can measure it by neck disability index. That is a quite common questionnaire for the neck pain. When there is a neck pain, we use this questionnaire a lot for the neck pain. It is widely used around the world. The second one is smartphone addiction scale for the text-neck syndrome. Smartphone addiction scale predicts your addiction rate, that how much you are addicted to your phone. It is a 33-point scale actually, but there is also a shorter version that is 10 or 11 points. It asks different questions from the patients and measure it by a Likert scale. A Likert scale is a 6-point scale with the options of strongly agree, strongly disagree, slightly disagree, like these points. And they ask questions like, do you use your smartphone right after waking up? If you say yes, then you will get 1 point for it. Then there will be next question. If you use your smartphones, can you imagine your life without your smartphone? If you say yes, so you will have another point. Then there are other questions like that. If you are using your smartphone, you are taking your smartphone with your washroom and going to washroom. So many people today take their smartphones even to the washrooms. Like, you are just going for 2-3 minutes over there, just leave the smartphone behind. Why are you bringing it with you in the washroom? So this shows the addiction rate, that how much people these days are addicted to the smartphones. Not only if they are using it beneficially, like there are positive benefits of it too, but they are just doing it an improper way, and this is not the thing that they should do. So the over prolonged use of time, or the more you use your smartphone, the more is your chances of getting text-neck syndrome. If you talk about the neck pain, differential diagnosis, so there can be text-neck syndrome. Radiculopathies are common in the spine. Cervical spondylosis, the degeneration, ankylosing spondylitis is also common in young age. Neck strain, disc herniation, neck arthritis, and facet syndrome. These are all terms that all conditions related to your cervical spine neck pain. You can do investigation for this TNS2 by doing cervical spine X-ray in anterior posterior position or lateral position. So if you do X-ray in a lateral spine X-ray, you will see that the cervical spine lordosis is decreased. Lordosis is decreased. This is a normal X-ray. You can see the C-shaped curve of the spine, and this is the abnormal X-ray. Where the spine is just straight, it has lost its lordosis. So the pressure, just imagine over here, all the pressure is coming on the vertebrae, on the facets, on the muscles, over the soft tissues. So that's why this has a really serious effect on the spine. If you lost your lordosis, you will have serious pathologies secondary to it. MRI for the soft tissues and HLA-B27 test is also common. You do this test, this blood test, when there is a chronic pain, there is inflammation. So this test is performed to differentiate or to exclude any autoimmune disease. You can diagnose it. You can diagnose your patient with TNS if the patient has neck pain and stiffness, and then you will look further for the symptoms that we discussed earlier. So, how will you prevent yourself from text neck syndrome? You can prevent yourself. Prevention is the key. Prevention is very easy of this, like just avoid excessive usage of the smartphone. If you are using 10 hours, for example, you are using more than 10 hours a day, just reduce the time 1 hour per day. Set a timetable for it. If you are using more than 10 hours per day, reduce it to 9 hours, then 8 hours, then 7 hours. So this is how you will you can prevent yourself from this condition. Second one is take frequent breaks during the work. If you are working on a computer, just move around, just get up from your seat, move around, and then come back and sit. So changing positions and taking frequent breaks can help. Regular screen breaks, if you are looking to your screen, just that's the similar, just move it from your eyes for a while so that your eye will not strain and the muscle will have some relaxation for a time. Keeping your head straight is very important. Not bending your head is important over here, because the more you bend your head, the more pressure and the more weight is increased on your spine. Keeping laptop high at eye level, just the way I'm doing it right now. Your laptop should be at your eye level. I know the tables or chair in our offices, in our homes are not adjusted. The ergonomics are different here. So you will have to work on the ergonomics too. If you cannot adjust your chair, if you cannot adjust your table or to the position so that you can have your laptop screen at your eyes, just place a block over under your laptop and make it above it. So that's the way the screen will be at your eye level. To support your upper body, including your neck, you can have different cushions for it, and you can have different procedures by which you can put your head up and the spine straight. So if a patient is having text neck syndrome, you will have 2 to 4 week sessions with him. As why 2 to 4 weeks? This is in this time you will be correcting his posture. So it is actually a syndrome. Not only there is neck pain, it is a syndrome. Syndrome means that there are quite a lot of areas are involved, quite a lot of symptoms are involved. This is not only one symptoms like neck pain and that's it. It is a syndrome. Syndrome means that there will be collection of symptoms. So by collection of symptoms, we mean there will be different parts of the body involved. There is not only neck involved, there will be shoulder involved, they will have headaches, they will have problem in their hands and elbows too. So that's why the time of treatment is 2 to 4 weeks. What is the physical therapy impression? What are your aims? You have to reduce the pain straight away. The first aim of any physical therapy protocol is just to reduce pain. Second is increase the range of motion. These are the two important things, because this is why patient is having discomfort. This is why patient is coming to the physical therapist. So you have to do these two things in almost every situation. Then work on the stiffness and the spasms. Then if there is any functional limitation, if patient is doing table work, office work, and using computer is a part of his office work, so you have to bring him on to that level. You should guide him with the proper usage of the devices, and then bring him back to that level so that he can work for hours over the computer with the specific guidelines. Muscle strengthening is important. Muscle strength length at a time, that is all important, because there was some hypoactive muscles and hyperactive muscles too. Uh, Inflammation is common, so for inflammation you will use different modalities or physical agents you can use for the time, and when inflammation is set off, then you can further do strengthening and other procedures. Physical agents that we can use are hot packs that can improve your blood supply. With the improvement of blood supply, there will increase nutrition to your soft tissues, and the pain and inflammation will ultimately relieve. Ice can be used in acute cases too. Ultrasound and TENS can be used too, to have control the pain and prepare the patient for the treatment. Or exercises, mobility exercises that you can prescribe even for the home, so that are looking downward and looking up. Looking towards the ceiling, that is extension of the cervical spine, and looking down is flexion of the cervical spine. Then looking towards one shoulder tip and second shoulder tip, that is your cervical spine rotation. Flexibility exercises can be included, and stretchings of pec major, sternocleidomastoid, trapezius plani, levator scapulae. These are important because they become hyperactive. Strengthening of scapular stabilizer and shoulder is important. You will have to strengthen them because they become weak. They will have winging of scapula. That's why the strength of upper thoracic is also important, and external rotator strengthening. What are the manual therapy techniques you can use? You can use the muscle energy techniques that are hold relax technique, quite common. Traction can be applied to reduce the undue pressure. Soft tissue manipulation are used to relieve the pain. Decreasing, you can also apply Maitland grade 1 to mobilization if there is pain, stiffness, and decreased range of motion over the vertebrae. Align the neck and joint mobilization. So there are different techniques that we commonly use for cervical spine. You can add them all. You can use a combination of all the protocols. You can use Maitland technique with the MET. You can use the traction with them. So with the combination of all these protocols, you will have a better result and a faster result. Ergonomic correction is the most important thing over here. If you are treating yourself and not even correcting your posture, it is of no use. And you will have the same neck pain, same neck stiffness again and again. Just like I said, that how Dr. Dean discovered this thing, that he was treating his patient with, he was treating from past 6 months her neck pain and stiffness, but she was not correcting her posture. She was doing that same activity again and again. That's why there was no result of his treatment. So ergonomic correction is very important. Use your phone at your eye level. Use your electronic devices or the laptops, tablets at your eye level. Place a cushion beneath it. Just make it up and keep your cervical spine or head straight. Just don't bend over your electronic devices. Make them adjust to your eyes. home advice to take is you can give the patient, that is quite important, is the hot for water fermentation they can do at home. Isometrics they can simply do at home. There are quite a lot of isometrics for it, like just do the stretches. The cervical spine is, its location is so easy that patient can do any exercise at home. Home-based exercises are very important, and self-stretching, they can apply the self-stretching techniques with them, and range of motion exercises. They can simply do these things at home. So it is important, it is important to have to reduce the forward head first. So how will you check if you are having forward head or not? To check your forward head posture, just stand straight to the wall. Your shoulders should touch the back, the side of the wall. If your shoulders are not touching, your occiput should touch the wall, your shoulders should touch the wall, and your whole lower extremity should touch the wall. Okay? If your shoulders tip, backward tips of your shoulders are not touching the wall, it means you have forward head posture. Your head is moving forward than its normal position. So this is the way to correct too. This is the correction procedure too, and checking procedure too. So just simply daily, just stand behind the wall for 1 minute and do this technique, and you will see that your posture or your muscle will gain its strength again. They will go back, your protected shoulders will retract, and your head will come to its position again. If we talk about the clinical implications, so musculoskeletal problems due to smartphone addiction has resolved can be resolved through social cognition, intervention, physical therapy, education. One thing here I want to add that these mobile companies or smartphone devices, electronic devices, are also responsible for this thing. Why? They should place a leaflet, like there is as you know, there is always a leaflet in a medication box. So they should enter a leaflet, they should prescribe a leaflet with every electronic device box, that how to use your electronic device in a proper way. They should tell people, they should inform them, they should instruct them about the proper posture. If people are aware of it, people are not even aware of what is posture, what is a normal posture. So if they are aware about it, how to use a device in a proper way, they will not have this thing quite in, and this text-neck syndrome can be reduced. So this thing is quite common. This is a just point that I suggest to them. Posture correction combined with selected exercise training improves the upper extremity symptoms, and limiting the forward head position will have decrease your spine malalignment. So these are the differences. This is the end of the session. I hope you got my point and you understand it clearly. I would like you to just give me some suggestions about it, or you can ask me questions. Ice use. Okay, so ice use or cryotherapy, we use ice when there is some muscle damage. And that is acute. So for acute conditions, we go for the ice, and for chronic conditions, we go for the heating. So for the first 24 hours, we will go for the cryotherapy. Later on, we will use the heat therapy. That will, for the muscle spasms and the joint complaints, you can go for that. For if there is muscle sprain, so you will go for ice. If there is some joint related issues, you will go for the heating. Any other question? Claudication is related to the neurological symptoms. Okay? Claudication is actually neurological symptoms that include the paresthesia, numbness, tingling, that comes with the movement. If you move your neck, if the patient is moving his neck during the neck range of motion, neck movement, his pain is radiating down to his upper arm and his elbows. That is actually neurogenic claudication. When pain is radiating to the extremities, and the pain nature is nerve.
5, 12, 4.
Any other question you can ask? Okay, summarize. So the summary is that this is the area of mobile technology. This is the area of modern technology. Our lives are totally dependent on these electronic devices. So what we have to do, that we are using it in an improper way. We are not even aware of the use of it. We are not even aware of a good posture. We are not even aware of a bad posture. We are using it almost in every situation. What the message of this session is: correct your postures, do it in a proper way. If you are using your phone, bring it onto your eye level. If you are using your laptops, bring the screen to your eye level so that undue pressure on your cervical spine will be eliminated. There will be no neck pain, no stiffness, no headaches, and your life will become easy. Yes, no one is used to bring his phone to eye level, but you have to do this if you want to get rid of these prolonged conditions and these serious conditions. So you have to adapt yourself to this good posture. Any other question? Share the recording. Okay, I think I'll share the recording with you guys later in the group. If we strengthen the sternocleidomastoid muscle, it's useful or not in text neck syndrome cases. No, you have not only to work on sternocleidomastoid, you have to work on the hypoactive muscles too and hyperactive too, and all the muscles, not only the sternocleidomastoid. If you are working only on just only on one muscles, then the results are not the same. So one participant here is saying that by bringing on the phone to eye level will bring tension on your upper limb. So yes, that can happen. Your elbows here will get problems too. So just as I said, take frequent breaks between the device you are using. Take frequent breaks, move around for a while, then come back. By taking frequent breaks after every hour or every 2 hours, you can have you will not have these issues again. Yes, we can use taping here, taping for the muscles, but taping have short-term effects. They are not used for long-term. Short-term effects for taping, you can use them. Okay, so you guys will have your quiz now. I hope you understand it completely. The quiz is all about the things I just said, and it is not that tough. So go back to your group and take your quiz. I just want to end this session right now, and I would like to pay thanks again to all the organization that is behind this, the Physio Real Life Academy. Thank you so much for having me. Thank you so much for this beautiful session. And I hope you guys keep doing this work at more and more high level. Just keep bonded all the countries with you. And that's all I have
Thank
to
you
say.
so much, ma'am. Thank you so much, ma'am, for very informative and knowledgeable sessions.
You are welcome. Okay, guys, so go for the quiz now. It's time for the quiz and get your certificates. Thank you.